dealt with under the Federal Election Code. Those are indexed, and the $1,000 from years ago is now a much higher number. And I would just suggest that this bill treats the political class with a greater accommodation than it does small business. I won't ask you to comment on that because I've lost eye contact with you, I think. I'm teasing you. Ms. Bjorklund, could I ask you to turn with me to page 21 in the bill, and it has to do with the ability to make ratings in the government-run plan. And assume for the sake of argument that we have two individuals. This is section 113. Same age, same amount of family, same zip code. One is very health conscious. She's in a Pilates class. She goes regularly to her physician, and she is the model of health. The other is a complete slob who eats potato chips, watches infomercials, and does absolutely nothing, and is grossly overweight based on his own decisions. Under this bill, those two people are going to pay the same premium. Isn't that right?
That is correct.
Okay. Let me turn your attention then to follow up on a line of inquiry that came from Mr. Reichert, or Mr. Richard, the French pronunciation from the chairman. And sort of following up, this is on this whole notion of cost-effectiveness research and how it can be manipulated. Just for the record, I wasn't persuaded by the merits of the argument that removing the plain language of the use rationing somehow creates an ambiguity. Or that the use of the word rationing creates the ambiguity. I think it would have been far more wise to leave it in. And let me ask you, can you turn between pages 501 and 524 is the section that really goes through in a great deal of detail about comparative effectiveness. Can you point to one area in that bill, in those pages that you drafted, that have any restraining influence whatsoever on rationing?
On page 533, because that provision goes through to page 533.
Okay, not in this one that I have in front of me, but I won't quibble with you. Okay. 533, go ahead.
On page 533, lines 16 through 19, nothing in this section, and the section that we're in is the comparative effectiveness section, shall be construed to permit the Commission or the Center to mandate coverage, reimbursement, or other policies for any public or private payer.
Okay, but here's the point. There's nothing in this bill that says that you can't deny coverage based on cost, and that, by definition, is rationing. And that, I think, is the weakness of the bill. I mean, you and I, our time is limited. I would welcome the chance to talk to you and other members of the majority on this, because I think it's a real weakness of the bill. Let me turn your attention then to another part, and that has to do with page 143. It's section 246, and it says in just a few short words that nothing in this bill is going to benefit anybody who's here illegally. What is it, Ms. Bjorklund, that animates the hope in you that a simple declaration in the law, like declarations that we have in the law that it's illegal to enter this country, are going to have any restraining influence whatsoever on people benefiting at taxpayer expense who shouldn't?
The law exists and it has to be enforced, but it says nothing in this subtitle shall allow federal payments for affordability credits on behalf of individuals who are not lawfully present in the United States.
But I'm not missing anything, am I? Somebody can simply come in and make a declaration and say, I'm here legally, I'm demanding that. You have nothing in this bill that would prohibit that. Isn't that right?
I don't believe